Welcome, everyone. And as Julio said, this is our webinar on African Americans and Alzheimer's, Innovating to Turn the Tide. And we're really pleased to be with you this afternoon. Again, I'm Molly French. I'm the Director of Public Health here at the Alzheimer's Association. And I want to extend a warm welcome to our co-hosts for this webinar, the Balm and Gilead. Here, in terms of the operations of the webinar, I'm joined by my colleague, John Sheehan. He's a public policy colleague here at the Association, and we're also honored to have him presenting today. The webinar was motivated by the clear and growing evidence that Alzheimer's and other dementias places what is often a disproportionately heavy burden on the African American community. It's an issue that greatly needs a lot more public health attention, and we really hope and want you to use the information ideas from today's webinar to start addressing these disparities. I am going to go through a few, quickly go through a few housekeeping items before we get started, just so that we have a sense of who's on the line today with the webinar. Please take a couple minutes, or a couple seconds actually, to answer our quick poll on either the right or left side of your screen. We just want to find out if your professional field is in public health, healthcare, you're actually directly working in Alzheimer's and other dementias, or if you're in another field. As Julio mentioned, we are recording this webinar because we always get requests to make it available after the webinar. And also we have muted all the phone lines for quality audio, but we do love audience interaction. So please, please, please use that chat function on the side of your screen for questions and comments throughout the presentation. So we are going to have two question and comment periods. So this is a little unusual. I just wanted to flag it so that you can actually start typing in your questions and comments now. So the first break will be about halfway into the webinar, and it's just going to be limited to whatever you type into the chat system. So that first break is just a chat-only Q&A, and then we'll have the presenters respond. Then the final question and answer period, discussion period, we will ask Julio to return again and open up the lines for so that we can also take questions, comments by phone. Again, please use the chat function anytime during the webinar. And then next week, we'll email all of you the recording of the webinar, some of the links, and the slides. We do want to acknowledge the Centers for Disease Control and Prevention for the cooperative agreement that does enable us to offer this webinar, but of course, the opinions of the speakers are solely of their own. We're going to close the poll in just a couple seconds, so be sure to respond to it. And again, if you're just joining us, I'm Molly French from the Alzheimer's Association with our webinar on African Americans and Alzheimer's. So real quickly, we see that a large percentage of you, about 60%, are actually working directly on Alzheimer's and other dementias, so welcome. And we also have a large group in public health and also healthcare, so thank you very much. Over the next 15 minutes, our goal is to inspire you to take action to address the heavy burden of Alzheimer's among African Americans. And we are very honored to feature three of our most important Healthy Brain Initiative partners, the CDC, as I mentioned, co-hosting with us, the Balm and Gilead, and also want to welcome the Healthy Brain Research Network. Before I turn it over to Pamela Price with the Balm and Gilead to say a few words of welcome, I do want to introduce her. We are so honored to have Ms. Price with us and as a co-host. Ms. Price currently serves as the Deputy Director of the Balm and Gilead. Under her leadership, the organization provides support to faith institutions in the areas of program design, implementation, and evaluation to strengthen their capacity to deliver programs and services that contribute to the elimination of health disparities. In addition to her role as Deputy Director, Ms. Price serves as Director for the National Brain Health Center for African Americans. She has a BS in Public Health and over 16 years of experience in public health, epidemiology, and healthcare. Mrs. Price, would you like to say a few words of welcome?
Hi, thank you so much, Molly, for that introduction. And on behalf of the founder and CEO here at the Balm and Gilead, Dr. Pernessa Seal, again, our partners at CDC and the Healthy Brain Initiative, as well as the Healthy Brain Research Network, I definitely want to extend a warm welcome and thank you to everyone for joining us today. We really hope that this will be an informative and interactive webinar as we look to discuss Alzheimer's disease, its impact on African Americans, and really how we can work together, as the title of today's webinar says, to turn the tide in addressing some of the challenges and issues that we have in the African American community around Alzheimer's disease and dementia. So again, we want to thank you for taking the time out to join us today. Please take advantage of the opportunity to ask us questions. We definitely want to hear from you. And again, just thank you for joining us today. I'll turn it back over to Molly.
Thank you so much. And just a reminder that if you're just joining us, we will have two discussion breaks. The first one will be by chat function only, so just type in your questions or your comments as they occur to you. So we will begin first learning about how Alzheimer's disproportionately affects African Americans. We'll have a discussion break. Then you're going to get to hear about the neat things that the Balm and Gilead is doing, as well as the Healthy Brain Research Network, to start using the disparities. And then we look forward to a full discussion with you via telephone and chat towards the end of the webinar. So active participation really makes a difference with the webinar, so please don't be shy. Now I'm going to ask Ms. Price to introduce our other subject matter experts.
Thank you. So we are really excited to have, again, a partner of ours at CDC and the Healthy Brain Initiative, Dr. Lisa McGuire. She is the lead of the Centers for Disease Control and Prevention, Alzheimer's Disease, and Healthy Aging Program. So this is a program houses the congressionally appropriated Healthy Brain Initiative. Dr. McGuire earned her PhD in Lifespan Development Psychology from Bowling Green State University and completed a National Institute of Mental Health postdoctoral fellowship in the Gerontology Center at the Pennsylvania State University. She joined CDC in 2004 and has published over 75 articles and book chapters on aspects of chronic health conditions, obesity, cognition, brain injury, disability, caregiving, and aging. We also are happy to have with us today John Shahan, who is an analysis in the Public Policy Division at the Alzheimer's Association. He's been with the association now for over 4 years, and he works across the many disciplines there, including public health, state affairs, and global efforts. And then we also have with us today Dr. Basia Belza. She is the Aljoya Endowed Professor in Aging in the School of Nursing and an investigator with the Health Promotion Research Center at the University of Washington. She's also the lead of the CDC-funded Coordinating Center for the Healthy Brain Research Network, and her scholarship focuses on improving the health of older adults. So again, we are pleased to have all of our speakers and presenters with us here today and look forward to a great discussion with you. And so with that, we will now turn it over and hear from Dr. Lisa McGuire.
Great. Thank you very much, Pam and Molly, for coordinating this today. So I'm going to start out and talk a little bit about some of the top-line results from the Behavioral Risk Factor Surveillance System, which you'll hear a little bit about, and what it is and where it's housed that we do at CDC. And I will also talk a little bit about some of the results that we're finding that are specific to African Americans. So I like to start out my presentations with looking at the population projections and looking at the actual population in the U.S. and then looking at that into the population projection. So I know most of the folks on the phone today are people who are aware of this issue, but we do know that we have a growing older adult population, and we're seeing it growing in ways that it has not grown before and as rapidly too. So this raises some issues for us in public health that we're going to talk about today. And some of the ways that we do that is we do that at CDC through the Alzheimer's disease and healthy aging program, where we house our Healthy Brain Initiative that Pam mentioned. With this, we're trying to really promote the health and quality of life of older Americans. And, we do this through collecting and analyzing and disseminating lots of data that can be used for public health practice and public health action, as well as translating research, peer-reviewed research into practice, so it can be utilized by other individuals. And we do all this by working with states, partners, and communities that can help us move all of this forward to really benefit older Americans. Now, this part of what I'm going to be talking today is about Alzheimer's disease and dementia. And one of the ways that we measure it on the national surveys is we use a concept called subjective cognitive decline. And what subjective cognitive decline is it gives people the opportunity to evaluate their own cognitive functioning, so their memory, their thinking, and their reasoning, and comparing it to how they perceived or interpreted their memory, thinking, and reasoning previously. Now, why this is so important is we do know, based on the literature, that subjective cognitive decline can be a precursor to what later becomes dementia or potentially Alzheimer's disease. Now, this is consistent for the public health perspective is because it opens avenues for action within that traditional role of public health. Now, why Alzheimer's disease and dementia are so important for the public health community is that we know 5.5 million Americans of all ages do have Alzheimer's disease, and we know that Alzheimer's disease is the 5th leading cause of death for Americans 65 years old and older. And we know that there is a relationship between Alzheimer's disease and chronological age, which is one reason that very first graph that I showed you about the demographics is extremely important. So the behavioral risk factor surveillance system is one of the ways that we collect data at CDC. It is the world's largest continually conducted telephone survey for health surveillance system in the world. It measures individuals that are aged 18 years old and older who are not residing in an institutional setting. And we typically have between 400,000 and 500,000 respondents each year, depending on the survey. You can see here that I have listed that we have 440,000 respondents in 2015. And the reason that 2015 is listed is that's the most current year of the data that is publicly available. The great thing about the BRFSS data is it provides state-level or territory-level data on health status, health risk behaviors, and chronic health conditions. And, for many of these conditions, it is the only state-level data that exists. The best thing about the BRFSS for the users on the participating in the webinar is that the data is free and publicly available. The link's shown at the bottom of the slide. So in 2015 through 2017, so currently in the field, we had states, or actually we had several states that asked the questions of the subjective cognitive decline module in their state. So in 2015, which is the most current available data, we had 35 states ask the question. 2016, we had 16 states, and that data will be available late this year in 2017. And currently, 2 states in 2017 have the data in the field. But what these questions are asking is they're having people evaluate their own memory problems or concerns, evaluate what potential difficulties they're currently having that might be related to their memory problems, and ask also if they have discussed these concerns with their healthcare professionals. Now, what we see with this data overall is we see that about 11.5% of people in the U.S. population aged 45 and up report that they're experiencing some sort of subjective cognitive decline. And this is up slightly from the previous administration of the data in 2013. We do see that people who have lower levels of education are more likely to report SCD, and also that people who report SCD are much more likely to live alone than to live with others. Interestingly, we see less than half of the people with SCD report having spoken with their health care provider about this. We've looked and conducted some of the analysis specifically for African Americans. So stratifying for African Americans, we see that with African Americans, 1 out of 7 African Americans aged 45 years and older is reporting that they have subjective cognitive decline. Now, this wonderful graphic was developed by our colleague John Sheen, who's going to talk in a minute after I'm finished, and he can tell us a little bit more about the development of this infographic and how you can use it in your work as well too. We also know when we look at some of the chronic health conditions, we see that individuals who are reporting that they have SCD, we see that they're more likely to also report they're having diabetes, high blood pressure, they're more likely to be physically inactive, smokers, and also living alone. So one thing that we need to think about, too, is all these are very important from the public health perspective, but we also need to think about that live alone, because this is also a potentially vulnerable population of individuals who are residing by themselves and are expressing that they are having concerns about their memory. We do know that SCD can impact people's everyday lives. 46% reported that they could not volunteer, work, or socialize as they normally did. 48%, so less than half, said that they needed help with their day-to-day activities, and a little more than half said that they had to give up chores because of their subjective cognitive decline. We can see for African Americans, a little lower than the national average, so 44% indicate they've spoken with a health care professional. And of those individuals who have SCD, we see that 1 in 3 have reported they're having concerns paying for their medical care, which might be one of the reasons why they have not spoken to a health care professional. Also on the BRFS, we have a caregiving module that allows us to find out characteristics of the caregivers, the problems that they face, what some of the biggest care needs are that they are experiencing, and if people are not indicating that they're a caregiver, we also can find out if they anticipate in the next couple years being a caregiver to someone, a friend or a family member. Now, from a population perspective, there's some real important reasons for us to think about with caregiving as we're moving forward. We know that 85% of baby boomers desire to age in place. So we see that people, as they're getting older, want to remain in their homes or in the current place or situation that they are in, which may require more caregivers as we're moving forward. We know that currently there's about 7 caregivers per person that needs care, and we see that this number will drop to about 4 people, caregivers available for those needing care. And some of the main reasons that we're seeing this is the number of childless older adults is definitely growing. We know that 11.6% of women ages 80 to 84 were childless in 2010. We expect that by 2030, that will be about 16%. So not only are we having more childless adults, we are also having individuals having smaller families with a smaller pool of caregivers available. From that 2015 BRFSS caregiving module, we know that about 22% of individuals indicate that they are currently caring for a friend or family member. Of those caregivers, about 8.5% of them report that the main reason they're caring for that person is that they have Alzheimer's disease, dementia, or some other type of cognitive impairment. So they're indicating that's the main reason. We don't know if people may also have cognitive impairment in addition to the other reasons. We know that 53.7% are providing help managing personal care, and 79.8% have provided help managing household tasks. Some other highlights, we know that when we look at caregivers' physical and mental health, that they're more likely to report fair or poor physical health, depression, frequent mental distress, and physical distress and obesity than non-caregivers are as well. And we look forecasting in the future. So in the next 2 years, do you anticipate being a caregiver? We only see that 17.8% of non-caregivers expect to be providing care for someone due to a health issue moving forward. Now, so when we look at the profile of African American caregivers, we see that we have about 5.6 million African American caregivers that was reported in a 2015 report by the National Alliance for Caregiving and also AARP in their report. And we do know that about 2/3 of those individuals who are caregivers are also working either part-time or full-time. So what do we know about African American caregivers? We know that the typical caregiver is a 44-year-old woman who's currently caring for one adult, and that adult they're caring for is typically about a 66-year-old female relative who needs care because of a long-term physical condition. Well, what we also know, I'm trying to see if these things are going to pop up. We also know that she's typically employed, as I just said from the last slide, and she's typically employed almost 33 hours per week at her job, typically is not married, and is in very good or good health. She's a high school graduate or has some college, but usually not a degree. The average household income of this female caregiver is about $38,000, which is below the national median and the median for average caregivers in the United States, regardless of background. So what do we know about more information about the profile of the average African American caregiver? She's been providing care for about 4 years on average. She spends, I'm waiting for my animation to catch up with me here. She spends about 26.8 hours per week helping with about 1.1 ADLs, things such as bathing and dressing, and about 4.2 IADLs, things such as running errands, managing finances, and also she tends to help with medical or nursing tasks, such as giving injections, wound care, or managing medications. She's typically the sole unpaid caregiver for her loved one and provides care without assistance or paid help, and reports moderate amounts of burden due to this care. So what else do we know about African American caregivers? So in addition to the characteristics that I told you, we find that more than half of the African American caregivers find themselves being sandwiched, meaning that they're caring for both a younger person and also an older person at the same time. We also know that African American caregivers are more likely to reside with their care recipient and spend, 20 hours or more caring for that person. We also know that they're more likely to care for a non-relative than we see in other racial ethnic groups. 1 in 3 African American caregivers said their care recipient lives alone more than other caregivers. Okay. All right. Thank you very much, and I will entertain questions when the time comes, and I want to turn things over to my colleague, John Sheen.
Thank you for that wonderful overview, Dr. McGuire. For as many times as I look at BRFSS, I always learn something new, so it's always encouraging to see how the data comes together in different ways. So here at the Association, in partnership with CDC and the Balm and Gilead, we're pleased to offer the infographic that you see on your screen. We saw bits and pieces of it during Dr. McGuire's presentation, but the full-size, full sheet of paper infographic is available online at alz.org/publichealth. And we'll include all of the URLs, again, at the end of the webinar, as well as in the information we send out with the recording later next week. We encourage the public health community to use data about racial and ethnic disparities to inform public health programming and the policy response to those disparities. Here at the Association, we have some additional tools that can be used on this front, such as our race and ethnic disparities fact sheet, as well as additional information in this year's Alzheimer's disease facts and figures report. This has been a very exciting week in dementia research. Today concludes the Alzheimer's Association's International Conference, and a lot of these studies have been coming out, a lot of information, and some of it particularly relevant to today's webinar. First, it's been observed that African Americans are about twice as likely to have Alzheimer's or another dementia as similarly aged white Americans, and a new study this week found that among Americans in the oldest of age ranges, 90 plus, African Americans have about a 28% higher risk of dementia than their white peers. This is even after controlling for education, sex, and vascular comorbidities. Second, new findings are continuing to contribute to the growing evidence that adverse conditions across the lifespan have an adverse effect. One study found that certain neighborhood conditions like level of poverty, low education, unemployment, and substandard housing may account for some of the differences in dementia prevalence among African Americans born in the 1920s. It's an exciting study. We're learning more and more about it. And another study recently found an association between lifetime stress and later poorer cognitive performance in later life. So these studies, again, new findings just coming out this week, they're supporting the need for targeted interventions in both clinical care and at the community level to address these inequities. So here at the Association, we have a few additional resources that we just want to mention. On our online Public Health Alzheimer's Resource Center, again, alz.org/publichealth. We have infographics and state fact sheets from the 2015 BRFSS on both the cognitive module as well as the caregiver module from not only this past or the most recent year, 2015, but previous years as well. And specifically for today's webinar, we have our web portal for African Americans, alz.org/AfricanAmerican. Here you can find additional information specific to the African American community, along with our 24-hour helpline, able to connect different peers, different consumers with resources such as different support groups, care consultations, lots of good community resources. And so with that, I will turn it back over to Molly.
Thank you, John. And I want to just remind everyone to please use the chat function if you have any questions for Dr. McGuire or Mr. Sheehan. So we do have one question already, and really appreciate a quick shout out to Andrew DeFratis, who raised our first question. And he points out that the Alzheimer's Association, we often talk about and this is for Dr. McGuire. Here at the Alzheimer's Association, we often talk about each person living with dementia typically requires about 3 caregivers per person. And this is just in part because of as the disease or dementia progresses, people become more and more dependent on caregivers for those everyday activities. But Dr. McGuire, your data for the general population caregivers says that there are about 7 caregivers per person. So Andrew's wondering where the discrepancy might be, or you think from your research that other conditions are requiring more caregivers.
Okay, so thank you very much for that question, Andrea. Where that 7 is coming from is, and I was not clear, is that there's 7 available caregivers in the world for each person that's needing care. Not necessarily each person has 7 caregivers caring for them. So what we're trying to point out is the pool of potential caregivers is shrinking over time. So as we have more older adults who are going to be needing more care, the number of caregivers that are available in our society to provide caregiving either in a paid or an unpaid situation, there's fewer of them available.
And that has a lot of policy implications. And Dr. McGuire, I was hoping you could talk a little bit in terms of the first part of your presentation in terms of cognitive decline. And if you can explain to our participants a little bit about how cognitive decline and dementia can complicate care. You showed those statistics, for example, on cognitive decline and some common chronic conditions.
Thank you, Molly. So, one of the concerns that we have, as people have memory impairments, whether it is a dementia or it's just having some memory loss, is making sure that people are able to still manage their chronic conditions. So in other words, depending on the severity of the memory loss, you know, are they able to successfully manage their diabetes, their blood pressure? So what we see is that as memory impairment does tend to worsen, we see sometimes the self-management of those conditions is not as successful, and we need to have some assistance manning, so caregivers or someone helping to manage those chronic health conditions. Because we do know that when people's diabetes is unmanaged, we do see that there's it does impair their cognitive functioning, same thing with all the other cardiovascular conditions.
Very good. Well, that's worthy of a webinar in itself. Thank you. We did have a question, one of the chat questions I'm going to save for later on for the second discussion break, but there was a question about, can you address the concept of micro-insults over a lifetime when you're looking at disparities? And the research from AIC did not particularly address, go into micro-insults, but there certainly was, they were looking at lifetime stressful events as well as, just disadvantageous environments and living in those, and certainly micro-insults would be, I would think, part of that, could potentially be part of that disadvantageous or harmful environments. I do know that there has been other research just about the considerable wear and tear pathologically that occurs with discrimination, and that's broadly speaking. And I'm reading one more chat here. Okay. I think we have some very good, appreciate all the chat questions coming in. I'm going to save I also saw another one that I think we'll save to the next discussion break where we can take advantage of our next speakers. So we have been, I'm going to go ahead and transition, been really pleased and excited to see all the fantastic work that the Balm and Gilead is doing. And so I'm excited to have Ms. Price give you an overview of their work and the resources that they're making available.
Thank you so much, Molly. So I'll just jump right into really just the mission and history of the Balm and Gilead. So we are actually in our 28th year. This October we will be starting our 29th year of working with the faith community and other partners to address health disparities in the African-American community. We initially started the organization to address what was being seen in HIV in the African-American community, and have been able to really just strengthen and grow the relationships that our founder and CEO has made with the faith community to now really be able to, again, provide capacity building and technical assistance around creating health programs that are housed within our faith institutions, as really as well as just being a bridge between the faith community and public health, especially when you're working with the African-American community. Church and faith are such a central part of our lives, and so being able to bridge public health issues and just health issues in general, we're really able to have some positive impact. So overall, our organizational objectives, we want to enhance the capacity of the faith community, and we really are wanting them to be able to harness the power that they have from the pulpit in terms of our faith leaders. So we educate them on leadership. We educate them on how to do health promotion and prevention. We also want to make sure that they understand, public health concepts and disease models and disease management, and really provide a good resource of information and tools to our faith community and leaders. And really to also increase the participation and utilization of interventions, including research, which is a big issue in the African-American community, as well as, treatment and medication adherence. We want to build the capacity of national and community-based organizations as well as health department or public health agencies so that they can collaborate in an effective way with our faith partners around health promotion and disease prevention. And then to raise awareness really within the African American community across the board through faith institutions so that they can, again, help really create behavior change. Behavior change is just a challenge regardless of what disease you're talking about, and given just some of the stats that we've heard already as it relates to Alzheimer's disease, behavior change is definitely something that, you know, we work with our churches on to help, you know, reduce risk for certain diseases like Alzheimer's disease. So several of the Balm initiatives, which I feel there are more than what I have on this slide, but our biggest one is definitely our National Healthy Churches 2020 conference. For public health people, yes, that's a play for Healthy People 2020. And again, we do that because we are working with our churches to establish health programs that can, again, address health issues. We do work around hepatitis C, cervical cancer. We still continue to do work in HIV and AIDS. We have breastfeeding. We work to establish coalitions in different areas. We provide just a wide variety of toolkits and different resources to our churches. And then we also have faith-based physical activity programs where we are working with local partners in the community to actually train individuals from the churches or from kind of at-risk communities to become fitness instructors who then are able to provide classes to the community to help address things like chronic disease and obesity. And then our newest initiative and what has slowly become my fourth child is our National Brain Health Center for African Americans. This has really been a labor of love. Both myself and Dr. Seal personally are and experiencing the challenges of having a loved one with Alzheimer's disease or some type of cognitive health issue. And so we wanted to create really the center so that we could raise awareness among African Americans about Alzheimer's and other cognitive health issues, just because there's definitely a need for more education and information about just what dementia is. And so the center's primary objective really is to, again, do education, to raise awareness. We want to touch on the disease management, the impact that it's having on caregivers, and then also just the critical need for African Americans to participate in clinical studies. We were blessed and fortunate, again, to be able to create our center through the CDC's Healthy Brain Initiative as one of their grantees on that cooperative agreement. So again, we want to thank them again, Dr. McGuire and our other partners there at CDC for, again, really helping us support us to be able to do what we are hoping to do and accomplish through the center. Another arm of the center is also to work with providing training to health professionals around the issues that we see around cognitive issues and health among African Americans. We've been fortunate to partner with the National Black Nurses Association as well as some affiliate chapters of the National Medical Association to actually come out to them and provide training to them. So last year we were able to do trainings with about 14 chapters of the National Black Nurses Association across the country. We provided CEUs for them to be able to come out and participate in it, and then each chapter also conducted or hosted a community event, again, that was to raise the awareness about Alzheimer's and really the role that nurses can play to address some of the challenges that we have. The work that we're doing with our physicians this year is a little different, as we wanted to really, hopefully bring to providers' attention some of the cultural nuances and the way that culture and kind of faith is impacting all African Americans as it directly relates to Alzheimer's and other cognitive health issues. So those trainings are underway. And again, that's kind of, we are doing education and work in our faith and African American communities, but then also making sure that we're, again, making that connection with our health system and public health colleagues as well. So again, that's the National Brain Health Center. I think it might have been a duplicate size. So again, this is just an overview, as I've mentioned. So from the trainings that we're doing, we've also developed some toolkits that are specific to our faith leaders that they can use, again, to raise awareness about it, and then also working with our other partners like the MDMA and MNA to, again, to kind of meet the objectives of the National Brain Health Center. One of our biggest campaigns that came out of this was our Memory Sunday campaign. So this was a mobilization campaign. It was fashioned after our National Week of Prayer for the Healing of AIDS, which again, it's the 28th year that we've been doing that campaign. And basically what it is really just a national mobilization and education in our faith community, and providing them with tools and resources so that they can play a greater role in increasing awareness and an understanding about Alzheimer's specifically, as well as how to support our caregivers in their journey, and really seeing them as almost patients too, to those that are caring for their loved ones. The goal of Memory Sunday was to utilize the influence and the impact that we know our churches have to engage them around intentional activities that can contribute to Alzheimer's prevention, the treatment, as well as care, and then supporting those who are living with Alzheimer's and their caregivers. So Memory Sunday this year, which is it's the second Sunday in June, so we will continue again this campaign yearly. But this year, that second Sunday fell on June the 11th. We were fortunate enough to work with partners at the University of Kentucky and their Sanders Brown Center on Aging to adapt some previous materials that they had to create our Book of Alzheimer's, which is a comprehensive resource guide for African American congregations, really that touches on everything from what Alzheimer's is, understanding how to recognize the signs and symptoms, understanding the impact of the disease on caregivers, as well as looking at providing a resource of faith tools such as liturgical resources for our pastors, how to take moments in a Sunday service to bring up the issue and talk and shed some light on it. We talk about different tools such as memory screening that our churches can incorporate that into the work that they're doing through their health ministry, as well as creating spaces and what we call retreats for our caregivers. So the book itself is quite comprehensive. It even has sample social media posts and things that are already put together that our congregations who use social media were able to use that as a way to get information out there as well. So another part of what we did for that is that we created a 4-part webinar series for the initiative. And it went through everything in terms of what is Memory Sunday, so why is it that we created this campaign, and what we were, hoping to accomplish through it. Again, we touched on memory screenings. We talked about a caregivers retreat, and that's where we really honed and focused in on the challenges of caregivers, both the physical, the financial, and the emotional impact that being a caregiver has. And then we also had what we call the Faith Competency 101. And so, again, that was really just something for healthcare professionals who are engaging or working with African Americans around Alzheimer's and dementia, and really providing some information about how faith impacts African Americans in terms of their health behaviors, some of the barriers and challenges that African Americans have, and how hopefully healthcare professionals can work to overcome some of those. Some highlights from it. So up on the screen is one of the flyers that we had. We disseminated it and sent that out to our FACE network, we had sent the JPEG to several of our partners who printed them out and distributed them on our behalf. The image is one of the community events that one of our churches in Birmingham put together around Memory Sunday, where they invited individuals to come in, caregivers, and so we were really, again, excited to have them. Overall, we had 130 churches signed up and registered to participate with Memory Sunday this year, which equated to about 72,000 individuals in terms of reach through those congregations. And then we had just different actual live kind of in-person activities that the Balm or either our partners or representative went out and did. Ourselves, the Balm and our CEO went out to Lexington and Louisville, Kentucky, and did 2 events out there. Again, we had a really great representation in Birmingham as well as in Chattanooga, to the point that we'll be following up with those churches to continue the work that they, hopefully have kind of jump-started with their Memory Sunday project. And so in terms of getting involved with really any of our programs, as it's the National Brain Health Center, more information about Memory Sunday, again, as that is specifically looking to address what we're talking about today, which is Alzheimer's disease. But we have a mailing list where we send weekly messages out. We, oftentimes we'll partner with other organizations to do specific content out through our what we call our Sunday morning health corner. These are, basically bulletins that our churches can put up, on a Sunday morning or, after a Wednesday Bible study that has, really kind of condensed health information, but it's very useful, once we can get it in the hands of our actual churches and the health coordinators. We also go and do healthy churches or capacity building training with local churches. We support, either organizations or perhaps just an individual who is interested in starting an actual coalition in their area. Given the scale and scope of the issues that we have around Alzheimer's and other health disparities in the African-American community, the more we can get churches and different community organizations to work together, the impact is just that much greater, as well as it's just a better use of resources as well. And then so we have, again, social media pages for our National Brain Health Center, both on Facebook as well as on Twitter. And then we also have our website. That website is where you can find, more information about Memory Sunday. You can also fact sheets. There's definitely tons of resources and links to the Alzheimer's Association, who has, just has a wealth of wonderful information. And then also our corporate website, which is the balmandgilead.org. So I, thank everyone again for taking the time, and hope that you are enjoying the presentation.
Thank you so much, Pam. And now I'd like to have Dr. Basia Belza talk about some of the work that the Healthy Brain Research Network is doing.
Thank you very much, Molly. Supported by the CDC Alzheimer's Disease and Healthy Aging Program, the Healthy Brain Research Network is a thematic network that builds upon collaborative strengths of 6 academic institutions and community partners. Our work is informed by the Public Health Roadmap, and we are very committed to addressing the issues related to cognitive health and reducing the risks. In this brief presentation, I wanted to share with you some of the projects that we're currently doing that address the needs of African Americans as well as other ethnically diverse communities. First of all, I wanted to share with you a project that is led by Raina Croft at Oregon Health Sciences University called SHARP. It's sharing history through active reminiscence and photo imagery. This is a really innovative intervention in which she targets African Americans age 55 and older with the goal to maintain or increase cognitive function. This intervention actually has health education and memory sessions. It also has a group walking program, but what is really unique about this program is there is group reminiscing that occurs while adults are walking. And she's developed these memory markers throughout the Portland area that focus on African-American historical events. These might include public marches, they might include church services, or some traditional barbershops frequented by African-Americans. So you'll see on this slide an example of one of those maps. And you can see how an individual might look at where that map is and then be able to recall their recollection as far as certain events. This is an event that happened in 1963. It was a memorial parade and demonstration with solidarity among those in the civil rights movement. And so the walkers, as part of this program then, would sort of recount upon their experiences of their involvement in this event. And Dr. Croft has created multiple maps and events like this in the Portland area. Another initiative is at University of Pennsylvania, in which our colleagues there, under the leadership of Dr. Jordan and Karlowicz, have developed culturally relevant messages to promote awareness about dementia, to increase detection and adoption of strategies to preserve cognitive health. Their particular target is looking at adult children and looking at ways to change their behavior so they can accompany a parent to a provider appointment in which the parent may be having some cognitive changes. So based on research, including focus group findings, this team actually has identified knowledge, practices, and attitudes and beliefs related to cognitive health. They've then taken this information and developed culturally sensitive messages for African Americans and non-Hispanic whites. They've tested these messages, and now what they have provided to all of us is culturally relevant, research-driven ads. So this is all about messaging related to, again, targeting adults who have concern about a parent with changes in their cognition. You can access these two, as well as other ads, by contacting the communications coordinator listed on this particular slide. In addition to these two projects, the Healthy Brain Research Network has a number of other initiatives targeting a number of different ethnically diverse groups. Our colleagues at University of Arizona have trained over 60 tribal-based home health workers to initiate conversations about brain health and refer for either social services or evaluation of cognitive decline. University of Pennsylvania has worked with the BRFSS cognitive module. This is, Lisa McGuire talked about this a little bit earlier, and specifically in relationship to various racial groups. Our colleagues at University of Illinois at Chicago have interviewed Latinos. They're looking at, and specifically, caregiving in relationship to cognitive impairment. One of our affiliates, University of Houston, has developed a course specifically for people with Alzheimer's disease and their partners. Banner Health, in partnership with University of Arizona, is in the process of developing clinical practice guidelines. This is to address cognitive changes during wellness visits, and they are targeting a Hispanic community. Here at University of Washington, we've worked in partnership with University of Pennsylvania, and we are testing those messages with adult children and Asian American Pacific Islanders. And our colleagues at University of South Carolina, with their focus on communications, they looked at specifically at social media blogs in relationship to Alzheimer's disease, dementia, and their caregivers. So it's been my pleasure to share with you some of the projects that we're currently doing, and I wish you all very much good work with the work that you're doing, and I look forward to our discussion.
Thank you so much, Dr. Belza. And I just want to congratulate the Balm and Gilead and the Healthy Brain Research Network. And I think they're just doing such creative and really savvy ways to reach out to the African-American communities and partner with them on Alzheimer's and other dementias, including, I love that they're focused on the caregivers, the people living with the disease, as well as raising awareness about ways to promote brain health. We're going to be ready to open up the lines. So Julio, if you'd give everyone instructions about that so that we can hear your thoughts on these interventions.
At this time, I would like to remind everyone, in order to ask a question, press star, then the number 1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster.
And this is Molly French again with Alzheimer's Association. I know we're getting close to the 3 o'clock hour, but we will extend the time a little bit to try and address a few questions. I do want to, while we wait for people to queue up, Pamela, Jackie and Craig had asked for how to access the University of Kentucky's The Book of Alzheimer's, and also we're wondering what communities you had been training and working in partnership with the National Black Nurses Association and National Medical Association. So I will work with, I'm sure that's a question other people have, and so I hope we can get some information in our follow-up webinar email to everyone about that. Another question that came in for you, Ms. Price, is do you have any best practices that you can share with us about working with churches?
So sure, to the first comment, Molly, yeah, I definitely can provide you a list of the MBNA chapters where we went and actually conducted those trainings and kind of highlight the ones that, again, the Birmingham chapter is actually one of their president is actually the one who coordinated the Memory Sunday activities this year for that area. But I can definitely let you know those locations where we are. The Book of Alzheimer's itself is actually available on our website to download for free. If you would like hard copies of the book as well, you can go to our website in terms of how to order them directly from a publisher and have them sent directly to you. And I can send you all of that information as well, Molly, if you want to send that out to all the attendees for today. In terms of best practices, if it's probably one key thing that we kind of always share with anybody really is to take the time to foster the relationship with churches. Churches typically get asked to participate in really just a wide variety of things, and so when you can come to them with something that they can see the value in and see that this is a relationship that you're trying to establish versus coming to them wanting them to perhaps just maybe do some surveys or collect data. And then also making sure that you are, if you're working with them, that you're reporting back to those pastors, you're reporting back to those leaders what you're actually doing and the outcome. One of the biggest feedbacks that we get from churches is, especially those that participate in research type projects, is that they never hear what came out of the information that they've helped to collect. And then they are also, again, looking for partnerships that are long-term in nature in terms of being able to be diverse in what the church is needing. And that's usually where it starts. Find out what's important to that pastor, what's important to that congregation. That's the issue that they're going to work on and put their heart into and give you, resources and someone to work with.
Wow, that's a lot of great tips in just a short amount of time. Thank you so much. And that's, the comment about research and finding out what evaluation is just a perfect segue to you, Dr. Belza. And we had a question from, I hope I'm pronouncing this correctly, Shalisha. She said, and this is for you, Dr. Belza, given trends in the Alzheimer's and other dementias in the African-American community, what role can community-based research play in terms of turning the tide? And, thinking about not just Alzheimer's and dementia, but also dementia caregiving.
I think, thank you very much for that question. That's a really great observation. I do think research can play a real integral part. I think community-based research is an important way for us to move forward in building our science. I think we need better partnerships between academics and community partners, between community partners and clinical linkages. I think we can work collectively with our states and our other public health partners to be able to both create policies as well as generate more interest and funding in this area. I hope that answers your question. Otherwise, I'm happy to address it offline.
Thank you. And one final question that we'll just make time for you, Dr. McGuire. Joyce had a question of wondering how often is subjective cognitive decline a precursor to dementia? And And then there's follow-up questions. So the first part is, how often is subjective cognitive decline a precursor to dementia? And then the second part is, how do you differentiate subjective cognitive decline from other aging-related cognitive changes?
Okay, very good questions. I'll take the last one first. So how do you differentiate subjective cognitive decline from other normative or usual age changes in memory? Subjective cognitive decline on the behavioral risk factor surveillance system can also be detecting normal cognitive aging just as people are getting older. So in other words, the question's asking you, compared to, the past year, have you noticed changes in your thinking and reasoning? So in other words, if you have noticed changes in your functioning. So it doesn't necessarily mean that something is wrong, like as in Alzheimer's disease or dementia. It just means that you notice that there's some changes in your memory, just like we notice other changes in our bodies as we get older. It's one of those that people are asked to evaluate. How often is it a dementia or Alzheimer's disease? We do not know from the data, at least from the behavioral risk factor surveillance system. We do not know that information. The first question, Molly, was how often does it transition? So we have to keep in mind, just because with subjective cognitive decline, it doesn't mean that there are pathological changes that are going on in the brain. It can be just normative changes. So a lot of it really depends on the specific individual and their risk factors and risk behaviors of whether we will see the transition to Alzheimer's disease and dementia. Molly, did you want to add something else there based on some of the new AAIC information?
No, not at this time. I do think we will go ahead and try and respect our participants' time. It's over past 3 o'clock here on the Eastern time zone, and we just thank you so much for everyone for hanging in there. We hope that you got some information and some insights about first of all, that the Alzheimer's and dementia does have a large toll on the African-American communities, and then some creative ways, interesting ways that to get involved in helping address those disparities. I do want to thank our partner on the webinar, the Balm and Gilead, for co-hosting this webinar with us, and really appreciate the thoughtful presentations from Dr. McGuire, Mr. Sheehan, Ms. Price, and Dr. Belza. Next week, we will be sending you the PowerPoint slides, some of the information that was requested, along with a way to access a recorded webinar in case you want to share it with anybody. And again, thank you.